I call upon Stuart Tuckwood from Edinburgh to talk.
Good evening, everyone. As you said, I'm Stuart. I'm a charge nurse in neurosciences at Edinburgh and a representative for Unison at the hospital. I'd like to start by echoing the sentiments of Terry and Stuart so far and saying I think it's fantastic that we've got this opportunity to debate the direction of travel in the city and the way Cambridge is growing. I think quite often so far the plans of the city deal and of the local authorities have been presented to the public with very narrow terms of interest, very narrow ways of people expressing their opinions on them. So I think it's great that people come together and have a debate about how they want the city to actually grow. I'm not from Cambridge, as you may tell from my accent. It does actually get quite confusing in my work in neurosciences at the hospital. I've had people waking from comas who, when I've asked them if they know where they are, have said to me, Scotland. Which does get very confusing for some people. I did move to Cambridge several years ago because I wanted to become a highly skilled health professional, because I wanted to be trained and I wanted to be able to provide the safest and the best care that I can. Edinburgh, if you didn't know already, is a major trauma centre and a specialist centre for neurosciences for brain and spinal injuries for the entire east of England. The hospital performs surgeries and interventions that other regional hospitals can't. And that's a powerful draw for health professionals. The opportunity to work at the cutting edge and to learn from the very best was irresistible for me. It's something I feel is quite often not expected of nurses and other public servants more generally. I often hear talk of attracting the top talent in business, in science or in research, but it seems to be rarely applied to people who work in our public services. And it really should be, because we're at a time of huge challenges for the NHS and for our other public services. More and more is being expected: better services, transformations in the way we provide care, greater cooperation between acute hospitals and the community, but all with less funds and less staff. It's been likened to trying to turn your dinghy into a speedboat at the same time as bailing it out. Healthcare is increasingly complex and challenging, and we need to be able to attract ambitious, energetic and determined people to provide the services that we need. Yet we pay carers in the community barely the minimum wage or barely more. We're often hearing talk about neglect or poor care services, but we seem unwilling to provide carers a wage that would enable them to have a stable life or to fund the training and education necessary to help them be the best that they can be. The wage of a community carer is about £7.70 an hour starting. A store assistant in Aldi probably earns about £9 an hour. So is it any wonder that people choose not to do the complex, challenging and emotionally draining job of caring for people? And this is where the city deal and the wider associated investment in the region in Cambridge comes in. I don't need to tell you how overheated the Cambridge housing market is and how much the cost of living has increased in recent years. NHS staff are paid a nationally negotiated wage on different scales and different bands, which have risen by only about 2% in the last 5 or 6 years. For a long time now, we've relied on the goodwill and the sacrifice of NHS staff to keep their services going. But the situation can only hold for so long. Now, I love my job and I want to be able to do it as best as I can, but I do need to have a life as well, and a future comfortable life in Cambridge is growing steadily more elusive. I live in a house share with 5 students, 5 academics, PhDs, etc. Now it's not awful, I'm not complaining, but having done 10 years of communal living while being a student and while working in Glasgow, I would quite like some privacy. I would like to be able to get into the bathroom before I go to my shifts. And after 13 hours coordinating the neuro block of hospital through the night, it is frustrating to be able to come in and not get to the oven to cook your dinner. My mother visited me recently, and in my house she commented, she said to me, I don't know if I could live like this. And it did make me angry to comment. No, I wasn't too angry with my own mother, but I don't feel like I should have to be ashamed of where I live, or be ashamed to invite family or friends around. I did go to university, I slogged my way through placements in the NHS, and I worked doing minimum wage care work as well. And I've worked hard at my job since I got here, but still I'm unable to afford to rent or buy a good home in the city. And I'm in quite an enviable position. I'm a band 6 charge nurse at the hospital, and I spend most of my time supervising or directing the care and work on the wards that I go to. And we rely on band 2 or band 3 healthcare assistants to provide most of the direct care to patients, to wash them, to feed them, to change them. And it's a job they perform admirably and with dedication and patience in very challenging circumstances. But I've got no idea how they manage to get by on the wage they've got, how they can provide for their families or pay their rent. Most, to be honest, drive for miles around Cambridge from villages and the other towns because they can't afford to live locally. And it's planning a future here that's the most painful thing. My girlfriend is also a nurse in the hospital, and I want to be able to provide for her and possibly provide for her family in the future. But in Cambridge, I just can't see how that's going to be possible. I'm very lucky that she's not too demanding, but even then, the basic thing of a secure, comfortable home seem out of our reach. We can't save at the same rent as house prices, we can't save at the same rate as house prices are increasing here. And it's also the same for doctors and for other people who work in public services. And when aspiring young brain surgeons are moving to Manchester because they can't afford to rent a home in the city, you know that something's wrong. And we're here to talk about investment in Cambridge, but we can't divorce that from the reality of what's happening to our public services. When I got here, I was lucky enough to be given specialist training in nursing patients with spinal cord injuries at the London South Bank University. But cutbacks mean that training like that for Adam's nurses is completely under threat. And not only does that jeopardise the safety of patients being cared for in our specialist centres, but it means less recruitment of aspiring and ambitious healthcare professionals. And the level of stress and pressure of working in a packed, strained hospital is enormous. And when you add in the need to squeeze every penny to meet a target of £49 million savings this year, and you've got a toxic work environment, the local NHS, to be frank, is running on fumes, and if nothing's done to address the cost of living here, the engine will surely at some point give out entirely. It's short-sighted not to recognise this and to keep piling on the pressure that the City deal and the recent Evolution deal are doing. Both say good things about affordable housing, but the reality is they're driven by a desire to provide more growth, more investment, and bring more jobs and more people to work here. And key in every one of these deals is the desire to deliver this growth. But we should always be questioning whether this growth, this investment will actually make us healthier or make us happier. Huge parts of the country suffer from chronic underinvestment, but Cambridge seems to have enough for several cities altogether, and all the associated problems that come with it. Now, I think that good public services are an integral part of healthy communities. Not only do the problems associated with growth make it difficult for us to attract and to keep public servants, but the new homes and the thousands of new residents and the investment place an intolerable pressure on the services that aren't getting any similar kind of investment. One of the key reasons for the financial problems that Addenbrooke's faces is the inability to perform specialist surgeries or the treatments that we need to do as a specialist centre, because all the beds are filled up with patients from in Cambridge and around there. So it's very sad to say, because I love the city and I love the area, I love living here, but when your girlfriend keeps on insisting showing you pictures of 4-bedroom houses that you can afford in Glasgow, it's going to be impossible to cater for too much longer. So, and I feel there's a lot of public servants and a lot of people in the hospitals and schools that we feel much the same. So I'm glad to see that people are questioning the deals that were being offered and questioning whether this actually is good for people to live here and good for our communities. Thank you.